record it. Come in.
Good evening. How are you?
Good. How are you?
It's okay.
I just totally slipped up on my words there. How are you?
I'm good. So my name is Anna Ferguson, and I'm the speech language pathology graduate student working with you today. What would you like me to call you?
I'm Katie. You can call me Katie.
Okay, and what is your relationship to Hadley?
Hadley is my daughter.
Okay, so to give you a little more clarity, as a speech language pathology graduate student, I help assess and treat people who have speech, language, voice, and fluency disorders, as well as feeding and swallowing difficulties. What is the main concern that brought you in today?
Well,
I forgot to wash my hands, so I'm going to do that right now.
Oh, sure. Um, I brought her in because I'm worried about her. So she's got very few single words. And I know for her age, almost 3, that's not on track. She's using a lot of different gestures, but not words. So like we want her to use her words, but it's not happening. She makes noises. She knows her animal sounds, and she'll make car sounds like vroom vroom, and she knows her moos and her nays and her bahs. Um, but she is seeming like she's avoiding speaking above everything else. She's not doing it.
Okay, so to rephrase, she is using very single words or very few single words.
Yeah.
Just using a lot of different gestures to communicate, and you think that she may be avoiding talking completely.
Yeah, she won't even try and imitate me.
Okay, so how do you feel that this is affecting Hadley's everyday life?
She's not communicating, verbally. I want her to be able to verbally communicate. I want her to be able to tell me what she wants. I want her to be able to talk to me. I mean, her everyday life is not being able to communicate her wants and needs or have a conversation.
Okay, so do you think that your main goal aligns with the fact that we want her to be more, we want her to communicate more?
Yeah, I want her to communicate, period.
Okay, so to summarize, we want her to be able to communicate more, use more words, and be able to communicate effectively with her teachers, friends, peers, and family.
Yeah.
Okay. Do you have any further questions?
I mean, is she ever going to talk? I just don't know what's going on. Her younger sister is 13 months old, and I swear she says more than Hadley does.
I can't promise that she's ever going to talk, but obviously that is going to be our initial and critical goal for Hadley. And hopefully we will get there one way or another, or if not, find an alternative way for her to communicate.
Okay. Well, another random question. Um, if you start doing therapy with her, will it be here? And I what do I need to do? Like I want to know how to fix it, but I guess I could run errands when you're with her, but I'd prefer I'd be there. I have to take both kids everywhere. Um, will having Georgia in the room with Hadley be too much of a distraction?
How old is Georgia? And is Georgia a sibling?
Yeah, she's 13 months.
I personally think that it would be a distraction. A 13-month-old can be a little bit of a distraction when it comes to needing that one-on-one time that Hadley is going to need to do therapy. So initially, we have the parent and other family members sit in a waiting room.
Oh, okay. Could I see what's going on?
Some of our rooms do have windows that you're able to watch the session.
Okay, perfect.
So the next steps will be to continue with further evaluation, which will take just about roughly an hour. We'll set up a time to do that. And then after that, we will determine the best treatment plan for Hadley based off the results that we obtain.
Okay.
So thank you for coming in today.
Thank you.